Hi, my name is Katherine Cummings, and I'll be doing my intramuscular and subcutaneous checkoff for today. So to begin this checkup, we're going to start with the anatomical landmarks. I have my sister here to help me with that. So the first landmark that we're going to be doing, or the first few landmarks that we're going to be doing, is going to be for the intramuscular injections. So I'll start with that, starting with the deltoid. So the first one, which is going to be the deltoid, is right here. You can find that by feeling for the acromion process, which is going to be the bony prominence at the top, 2 fingers below that, and then pointing your thumb inwards. You can kind of see like a triangle, and in that triangle is where the muscle is going to be. All right, and the second landmark is going to be the ventral gluteal muscle, and that is going to be here. So the ventral gluteal muscle, you put the bottom of the palm on the greater trochanter, like such. You're going to face your thumb towards the pelvis, and then taking your 2 fingers, pointing them. I think this is thumb towards the pelvis. Yeah. Okay. Here it is. Just like so. And that's where you will find that. Okay. So the last one we're going to be doing is the vastus lateralis, which is the with your finger on the greater trochanter and your other hand on the knee, and adjusting your thumbs to point each other and your middle finger or your pointer fingers to do the same. You can see the kind of like the outline of that muscle in the leg. So those are the 3 anatomical landmarks for the intramuscular injections. And the 3 anatomical landmarks for subcutaneous injections are as follows. There's the outer posterior aspect of the shoulders. It's going to be like that fatty part right here. And then there is the abdomen. So in the abdomen, below the costal margin and above the iliac crest, we're going to be looking like kind of right here. And you're just going to want to avoid that umbilicus. So kind of where the natural pudginess happens right here. And then you're going to be, the last one is going to be the anterior aspect of the thigh. So in the thigh, this kind of fatty part right here at the top, that's going to be where that injection site is. Okay, so those are the anatomical injections for intramuscular and subcutaneous injections. Those are anatomical landmarks. All right, so I'm going to begin today in the med room. So first I'm going to sanitize entering the med room. I'm just going to look over the orders. I have my paper orders right here. So I'm going to be looking over them. So I see Anna Pobolowski, her date of birth is 5/5/57. I see that she has an order for an influenza vaccine, 0.5 milliliters intramuscularly today at 14:58. And she also has a prescription for a vitamin B12 subcutaneous injection. So for the vitamin B12, there is a bit of math that needs to be involved because it is dispensed as 1 milligram per milliliter. For the influenza vaccine, there is no math needed because it is dispensed as it is prescribed. So for the B12 subcutaneous injection, 1 milligram per milliliter. So I'm looking at, I know 1 milligram per milliliter is 1,000 micrograms. 1 milligram is 1,000 micrograms. And the order is for 500 micrograms. So 500 micrograms I know is 0.5 milliliters now. So I will be dispensing 0.5 milliliters of the vitamin B12 subcutaneous injection. Okay, and I see that Anna Pobolowski is allergic to penicillin and a common reaction is hives. All right. So Okay, so now I will be gathering my necessary equipment while I'm in the med room. My necessary equipment is going to be my syringes to begin with, per Seminole State's standards of Seminole State's Seminole State College's injection guide, or their standard. I will be giving the intramuscular injection in a 3 milliliter syringe. Normally I would be giving it, since it is half a milliliter, in a smaller syringe, but this is the only one I have on hand. And this needle is a 23 gauge, and it is 1 inch. So 23 gauge, 1 inch needle. I have labeled this for Anna Pawlowski. This is the influenza vaccine, and I've labeled this as such. It is 0.5 milliliters, and I'm writing my initial and the time and the date. And per the Seminole State College guidelines for subcutaneous injections, I have a 1 milliliter syringe. And with my guidelines in front of me, I know that this 5/8 25 gauge needle is the perfect one for a subcutaneous injection. Okay, so I'm going to be labeling this the same. This is a vitamin B12. It's giving to Anna Pawlowski. The date, the time, my initials, and the amount, which is going to be 500 micrograms. All right. I also have some alcohol gauze, some gloves, a sharps container, hand sanitizer, something to blot blood in case of any bleeding, and my medication. Okay. So going on with the orders, I'm going to check them for any allergies that might tell me not to give this vaccine. I don't see any allergies to eggs, so I will continue to give the influenza vaccine. All right, so I'm going to prepare the medication, sanitizing my hands first. So I'm going to begin by drawing up the medication from the vials. So I'm going to assess the vials for their expiration date, and I see that this expiration date in this vial, it is not expired. I'm going to look in the medication itself, and it's clear, it's not cloudy or anything. And there is a time, date, and initial on the vial. If there were not, and I was opening this fresh, I would be opening this and time, date, and initial it for now. Same thing with my vitamin B12, which is this medication right here. The expiration date has not expired. There is no cloudiness in the medication at all that might indicate it has expired. And there's a time, date, and initial on it already. If there were not, then I would be, again, writing it when I open it myself for the first time. If there were not and it was already opened, I would find another form of the medication. I would find another bottle of medication because that would not be good. Good. So now I'm going to draw the medication up. Starting with the influenza vaccine, I'm going to draw up 5 milliliters of air. First time. I'm going to drop 5 milliliters of air, or 0.5 milliliters of air. So 0.5 milliliters of air, and then I'm going to inject that into my medication vial, and then draw up that medication. Tapping it to get any air bubbles away. And I know that I can just kind of just adjust that medication until I've gotten rid of all those air bubbles. Okay, perfect. So there's no air bubbles. So I have this medication now. And now, using my alcohol swab, I'm going to clean this one off and begin with the other one. Let's see here. Injecting 0.5 milliliters of air into the vial. Okay, so that's the vitamin B12 and the influenza vaccine. All right. So now again, these syringes are already labeled, as I like to label them before I draw the medication, just so that I don't have to label it. Medication on. Okay, so now I'm going to verify that this medication here is for my patient, and then I'm going to go into the patient's room. So verifying for the final time, or not for the final time, verifying that this is for Anna Pawlowski. Her date of birth is 5/5/57. She is allergic to penicillin. This is the influenza vaccine for today, 0.5 milliliters intramuscularly at now, which is 14:58. And the B12 subcutaneous injection of 500 micrograms today, subcutaneously, at 14:58, which is now, all for Anna Pawlowski. All right. So now I'm going to, now that I've verified that, I'm going to enter the patient's room with all my necessary supplies. Hi, my name is Katherine, and I'm going to be your student nurse for today. Could you tell me your name and date of birth for me, please? Okay, Anna, and could you tell me, are you allergic to anything? Oh, you are, to penicillin? Could you tell me what happens when you take penicillin? Oh, you break out in hives. All right, well, I'll make sure not to give you any of that. All right, so for today, I will be giving you your medications. But first, before we get into anything, I'm going to look over the area. I see that there's no clutter on the floor. The bed's in the lowest position. The guardrails are up. The call light is nearby. The bed is locked. All right, and I'm just going to draw this curtain back. Perfect. Okay, so are you in a comfortable position? I'm just going to raise you up so I don't break my back bending over. Okay, perfect. All right, so today I'm going to be giving you your medication. Beginning with the medication of your flu vaccine. I'm going to be giving you your influenza shot, and I'm going to be giving you your vitamin B12 subcutaneous injection. Have you gotten the flu shot before? Okay, so have you had any side effects when you got that flu shot? You didn't? Okay, that's good. Well, you should know before I give you this injection that a typical side effects for the flu shot are localized tenderness and soreness in the arm. Could lead, you could get a fever or a general feel of malaise, but if you do, just let me know. That's a typical side effect, but you can always just let us know. For the vitamin B12, some side effects behind that are hypertension. You could get a rash or some skin redness, some GI upset, and you could get a headache. So if you feel any of these, please let us know. Okay, so for today, we're going to be beginning with the influenza vaccine. So before I give you this medication, I'm going to just verify that this is Anna Pawlowski in front of me, that her date of birth is 5/5/57. She has an allergy to penicillin and she breaks out in hives when she takes it. She is getting her influenza vaccine intramuscularly today, 0.5 milliliters at now, which is 14:58. And her vitamin B12 subcutaneous injection of 500 micrograms or 0.5 milliliters today, now at 14:58. subcutaneously. So now that I've verified the named dose, time, drug, and route, I'm going to begin with this injection. So could you tell me, Anna, which arm are you most dominant in? So your right hand dominant? Okay, so I'm going to do this injection in your left arm because like I said, this does leave some localized tenderness or soreness, and we don't want your dominant arm to feel sore. So, so let me just see the arm. Could you just relax for me? All right, so I'm going to first put on my gloves. I'm going to sanitize. Glove up. And I have my sharps container nearby. Okay, perfect. The first thing I'm going to do is I'm going to take this alcohol swab and I'm going to, in a circular motion, just kind of sanitize the area like that. Starting on the inside and then working my way out. All right. So verifying that this is the right medication. I'm going to be using the Z-Track technique. So I'm going to, using my anatomical landmarks that I just said, I'm going to identify this is the right spot using my Z-Track technique. Just pull the skin taut and inject the medication dart-like into the skin. Don't break the needle. And then slowly inject the medication into the muscle, letting it sit for about 5 to 10 seconds so that the muscle takes it, and then quickly pulling it out. One-handed scoop. And into the sharps. Okay, so now I'm just going to wait and look at the area, see if I can see any immediate redness or swelling. That tells me that something might be wrong. Okay, so I don't see any immediate redness or swelling. So I'm going to begin with the second injection. I'm just going to change my gloves real quick. All right. Okay, Anna, so while that takes, I'm just going to, for your subcutaneous injection, I'm going to be doing that in your abdomen. So have you ever gotten this subcutaneous injection in your abdomen before? You have. Okay, perfect. Do you know what side they used when they did that injection? They used the left? Okay, so in that case, I will be using the right. We don't want two on one side. So I will be injecting you subcutaneously in your abdomen on the right side. And okay, so like before, I'm just going to put some gloves on. Okay, perfect. And then like before, I'm going to be sanitizing the area using this alcohol pad. I'm going to, in a circular-like motion, starting from the inside and working my way out, just getting rid of all the dirt, possible dirt, sanitizing it. All right, so for the subcutaneous injection, I'm going to be pinching the skin. Okay, that fatty layer visible. And quickly, if my needle won't break, injecting that in. Quickly removing it. All right. And then if any blood were to be present, I would blot it for any possible bleeding. And if I did see any bleeding that wasn't immediately going away, then I would tape this down or put a Band-Aid over it. Okay, and I don't see any immediate redness or swelling that tells me that something might be wrong. So it tells me that That all looks good. Okay, Anna, if you feel any pain or discomfort due to these injections, please let me know. All right, so I'm going to now document these injections while I look for Anna for any side effects that might be immediate. I don't see any. She looks fine. Okay, Anna, so I'm going to just lower your bed, put it in the lowest position, give you your call light. Make sure your bed's locked still, and it definitely is. There's no clutter on the ground to get rid of the rest of my medical waste. Okay, can I get you anything, like a drink of water? Do you have to go to the bathroom now? No? Okay, perfect. Just verifying. I'm going to now open my curtain. Okay, Anna, you have a wonderful day, and I am leaving. All right, thank you.